diastolic dysfunction with the pure diastolic heart failure, left ventricular and systolic volume and stroke volume are preserved. There is, however, an abnormal increase in left ventricular diastolic pressure at any given volume. This reflects a decrease in left ventricular diastolic dispensability or compliance, such that a higher diastolic pressure is required to achieve the same diastolic volume or contractility. In a pressure volume plot, the diastolic dysfunction would therefore be characterized by a normal systolic pressure volume loop and a upward shift of the diastolic pressure volume loop without a change in diastolic volume. An action potential traveling along the sarcolemma and down into the transverse tubule, it's called the T-tubule system, depolarize the cell membrane. The voltage sensitivity dihydropyridine receptor open to permit calcium entry into the cell during phase 2 of the action potential. The calcium influx triggers a subsequent release of calcium that is stored in the sarcoplasmic reticulum (SR) through the calcium release channel and increase intracellular calcium concentration. Free calcium bind to troponin C, that is part of the regulatory complex attached to the SYN filament. When calcium binds to the troponin C, this induces a conformational change in the regulatory complex such that troponin I exposes a site on the actin molecule that is able to bind to the myosin ATP located on the myosin head. This binding results in ATP hydrolysis that supply energy for a conformational change to occur in the actin-myosin complex. The result of this change is a movement between the myosin head and the actin, such that the actin and the myosin filament slide past each other, thereby shortening the sarcomere length. The calcium entry into the cell slows, and the calcium is subsequent by the SR by an ATP-dependent calcium pump, lowering the cytosolic calcium concentration and removing calcium from the troponin C to a quantitatively smaller extent. Cytosolic calcium is transported out of the cell by the sodium-calcium exchange pump. Unbinding of inhibition of the actin binding site at the end of the cycle, a new ATP binds to the myosin head, displacing the ADP, and the initial sarcomere length is restored. Cause: coronary artery disease, diabetes, high blood pressure, and obesity. The cause of heart failure is a weak or sick cardiac muscle. For example, in chronic high blood pressure, hypertension, the heart must pump extra forcefully against the additional blood pressure. Assessment include the color, auscultation, physical appearance, chest X-ray, echo, and the BNP. So for the treatment, based on the current knowledge, the pharmacological logic treatment of diastolic heart failure should focus on the normalizing blood pressure, promoting regression of left ventricular hypertrophy, avoid tachycardia, treating symptoms of congestion, and maintain normal atrial contraction when possible. Diuretics therapy is a mainstay of treatment for preventing pulmonary congestion, while beta blocker appear to be useful in preventing tachycardia and thereby prolong left ventricular diastolic filling time. The angiotensin converting enzyme inhibitor and the angiotensin receptor blocker may be beneficial in patients with diastolic dysfunction, especially those with hypertension. The medication may be prescribed to treat or reduce the symptoms of diastolic heart failure. They include the angiotensin converting enzyme inhibitor, ACE inhibitor, and the angiotensin receptor blockers, which is ARBS, which relax blood vessels to improve the blood flow. Beta blockers, which can reduce blood pressure and slow a rapid heart rhythm. The calcium channel blocker and the long-acting nitrate to relax blood vessels, especially those that fit the heart muscle. Diuretics to reduce your body's fluid content by promoting urination. Vasodilators to open blood vessels if you cannot tolerate the ACE inhibitor or ARBS. Surgery and other procedures. If medications are not effective, your physician may recommend an angioplasty to open a blocked artery or surgery to repair a heart valve. Okay, so to determine if a patient has a diastolic heart failure, we ask questions about your medical history and do a physical exam. We use advanced diagnostic procedure and technology to effectively diagnose, inform treatment, and carefully monitor the condition. Common diagnostic procedure can include the blood test. The blood test can check the level of certain fats, cholesterol, sugar, and protein in the blood that could indicate heart conditions. The chest X-ray, a common imaging test of the lung, heart, and the aorta. The echocardiogram. This ultrasound exam uses sound waves to take moving pictures of the heart chamber and the valves. EKG. This test measures the electrical activity of the heart and can help determine if parts of the heart are enlarged, overwork or damaged. The heart electrical current are detected by 12 to 15 electrodes that are attached to the arm, legs, and the chest via the sticky tape. The electrophysiology study. This test records the heart's electrical activity and pathways. It can help find what's causing the heart rhythm problem and identify the best treatment. Stress test. This test is conducted during exercise. If a person cannot exercise, medicine is given to increase heart rate, used along with an EKG. The test can show change to the heart rate, rhythm, or electrical activity, as well as the blood pressure. Exercise makes the heart work harder and beat fast while heart tests are administered.